think that one of the main skills that students find very difficult is acknowledging cues when talking to patients and other health professionals. For example, they might be talking to a patient and they might be asking about smoking, and the patients they say, oh, well, how many cigarettes do you smoke a day? And the patient says, not many. And then they interpret that as not many, not thinking about how it was said and why it was said, because not many might be 10, it could be 20. So it's this Holt's law, listening to what people say and saying, well, do I need to double this? Look at the person's hands, and does it show that they are smoking very, very heavily? And also the tone of their voice, because it's not just the words, it's how it is said. People might ask, a doctor might ask somebody, well, have you had any similar problems before? And you might just say, well, perhaps once or twice. Of that once or twice, maybe 5 or 6 times. And therefore, anything that is vague would need to be asked about. So a couple of times. How many times is that? So every time you have a vague verbal communication, you want clarification. So there's constant need for clarification of a verbal input. Also clarification of how somebody says that. I mean, extreme example which we deal with is have you had thoughts of taking your life? It's quite a difficult question to answer because people don't like asking about questions like that. And the patient might say, no, never. That's fine. But the patient might say, well, no, not really. And then think, oh yes, definitely they're not. But that no, not really is hesitant. And then you sound hesitant. Well, yes, I have thought about it. So it's actually dealing with not just the words, but the function and the way the words were said that is important. And that is something that's missed a lot, even for very advanced students. Dealing with things like negative questions or negative criticism, or can't I have this medication, doctor? It's quite different from can I have this medication. Can't I have is criticizing the doctor for not giving it, or trying to persuade the doctor. So you've got different levels of function going on at the same time. And unless you're aware of that, it's quite easy to miss it in the communication. You could end up with totally different comprehension within a very simple dialogue. And the difficulty in all the communication really is the fact that you're dealing with a very small number of words in order to express an infinite amount of emotion and function. It's very, very different from other communication situations. When I'm getting students through communication, I ask them to think of the logical medical response as well as the linguistic response and the emotional response. And the response emotionally might be 2 things or 3 things simultaneously. And so getting them to be able to deal with an emotional response, i.e. hesitance, or worry, but the worry may be might have another meaning on top of it as well. But just getting them to appreciate one aspect of the emotional side is a beginning, and then you start breaking it down into other types of emotion. Well, you might have somebody, say, who's taken an overdose. So the first thing comes to my head, and who doesn't want to stay in hospital, take an overdose of paracetamol. The problem with that is that once the person's taken the overdose, they don't feel anything. They look perfectly normal. And they think, well, I want to go home. But it's very dangerous because the effects might be felt 20 hours afterwards. So trying to persuade someone who thinks that they're perfectly okay that they have to stay in hospital is not easy. That requires quite sophisticated skills. So you have to then get the person to think ahead, what happens if. And we deal specifically with this particular scenario in the books where you're looking at the language of imagining and supposition. Imagine you, say you, what would happen if you, how would you feel if? So could we perhaps stay even just another 20 hours and we keep an eye on you? And then during role play you might get the patient to insert excuses like, I have to look after my mother, I have to look after the children, or I'll come back if anything goes wrong. But if the person collapses or they're driving, then it's not just their lives, it's somebody else's life. So it's building a complete picture, not just looking at the words, but looking at a complete situation so that the doctor can build a picture not for themselves, but a picture for the patient as they are communicating with them in order to persuade them of the need to stay. There are many examples like that, but that's quite a neat one for